What is rabies and what causes it?
So dogs are the most important reservoir for rabies, and biting of dogs is what causes 98% of human rabies cases.
Is there any group of people who are at a high risk of getting animal bite?
So in our country, India, Bengaluru, because it has a huge trade dog problem, it contributes quite a lot to the total burden of rabies in the country.
A person who had a suspected rabid animal bite, when they approach a hospital, what they should expect?
So based on the WHO guidelines, it involves categorization of the wound based on the severity.
There had been complaints from the community that I had been bitten by a dog, the wound was big, but they did nothing.
In category 3 wounds, which are more severe wounds with a lot of bleeding.
So, dogs being the main culprit, we know that stray dog menace is a big problem in our country. Jai Shri Gurudev. Namaste and welcome to BGSMCH Aarogya Vani. Your health, our priority. I am your host Dr. Anu Mohandas, Associate Professor, Department of Community Medicine. And in today's episode of Aarogya Vani, we are going to discuss the oldest known disease, a disease that has been creating fear since ancient years. Rabies. Just imagine a simple bite or a small scratch from an animal deciding between life and death. Rabies is a disease which is 100% fatal, but which can be 100% preventable as well. To get us better understanding about this disease, we have our expert from BGS Medical College Hospital, Dr. Chirantan CM, Assistant Professor, Department of Community Medicine, and Medical Officer in charge of the Anti-Rabies Clinic. Hello, Dr. Chirantan. A very warm welcome to BGSMCH Aarogya Vani.
Jai Shri Gurudev. Thank you for the invite to Aarogya Vani.
Jai Shri Gurudev. To start the discussion, let us start from the basics. What is rabies and what causes it?
Rabies is a viral disease. It's a zoonotic disease which spreads by the biting of certain animals through the saliva of certain animals. It mainly affects the central nervous system of human beings, and it causes fatal encephalitis in us if untreated.
Okay, so you told that few animal bite causes rabies, right? Which are the most common reservoirs of rabies among animals?
So the most common reservoir for rabies virus is the most commonly known animal to us, which is the dog. Mm-hmm. And 98% of human rabies cases are caused by bites of rabid dogs.
So you told that dog bite is the most common cause for rabies. What about rodents like rats and squirrels? Does that also cause rabies?
So dogs are the most important reservoir for rabies, and biting of dogs is what causes 98% of human rabies cases. Along with that, certain other animals like cats, monkeys and mongooses are also known to spread rabies. And in very rare cases, certain other mammals can also spread rabies, but the percentage of that is quite low. The most commonly found rodents such as rats are not known to spread any rabies to human beings. But bites from rats require local wound care, but it is not known to spread rabies. So after the bite from a rat, the requirement of vaccination is not essential.
Okay. So dogs being the main culprit, we know that stray dog menace is a big problem in our country. How prevalent is rabies in our country?
So in the world as a whole, rabies causes more than 55 to 60,000 deaths per year. Mm-hmm. So out of that, 1/3 of the cases in the world happen in our country of India. So in our country, India, Bengaluru, because it has a huge trade dog problem, it contributes quite a lot to the total burden of rabies in the country.
If there is a suspected rabid animal bite, what need to be immediately done as a first aid?
So if a person is bitten by a suspected animal that can carry rabies, most commonly which happens through dogs, they can first do the first aid at home itself or wherever possible. The first step that they can do is something called the wound wash procedure, which involves the simple washing with running water and soap. So the wound and whatever exposure that has happened to the person has to be washed with soap or detergent along with running water for a complete 15 minutes.
Okay, so the first aid for animal bite is very simple. It's a simple wound wash that is required for 15 minutes with running water and soap. What next? Do they need to come and consult a doctor?
Yes, certainly. Any person who is bitten by a dog or an animal should consult a doctor and approach a facility where treatment for animal bites is available. So, the immediate procedures available in the hospitals are the wound wash once again. And even if the person has washed their wound at home, the wound wash procedure is repeated once again in the hospitals again. So, most clinics which can handle animal bites also involve the procedure of wound wash and followed by cleaning the wounds with antiseptic solutions.
So, even though the patient has washed at home, you will ensure that the wound toileting is properly done.
Yes.
And then what next? What is the protocol that you follow in an anti-rabies clinic?
So the protocol involves taking a detailed history of the bite, followed by categorizing of the wounds, and then deciding the treatment schedule. So based on the WHO guidelines, it involves categorization of the wound based on the severity. So it is divided into three categories: category 1, 2, and 3. So if the animal or dog has simply licked or nibbled on the intact skin, then it is considered as category 1. So category 1 as such doesn't require any management except the washing of the area which is exposed. Then category 2 is where there is a scratch mark or a superficial wound without any bleeding. This requires vaccination and tetanus shots along with proper wound care. And category 3 is where there is severe wounds and the wounds are deep and multiple. And this requires vaccination, tetanus shots, local wound care, and along with this, we need to infiltrate the wounds with rabies immunoglobulins.
Okay. So, it is mandatory that a person who had an animal bite of a suspected rabid animal should visit a rabies clinic, mainly because categorization of wounds has to be done. And this should be done by a doctor. This decision cannot be done by the person who is a victim of the wound bite. Okay. And according to the category of the wound, you decide the treatment. Mainly wound wash, vaccination, or immunoglobulin. Okay, you told which category of wound requires a vaccination. How is vaccination given? How many doses are there? And is it mandatory to complete the vaccination?
Yes, ma'am. So the vaccination can be given in two routes. And according to WHO guidelines, there is two ways where the injections can be given. So one is the intradermal route where the injection is given to the skin, and another is the intramuscular route where it is given into the muscle. So the intradermal regimen includes 2 injections per visit and 4 visits to the hospital over the course of 1 month. The injections are given on days 0, 3, 7, and 28. So when the vaccine is given intramuscularly, the patient will need to visit the hospital 5 times over the course of 1 month on days 0, 3, 7, 14, and 28.
Okay, you mentioned about 2 routes of administration of vaccine, intradermal as well as intramuscular. Is there any difference in the way immunogenicity happens in both the schedules?
No, ma'am. The immunity generated in both intradermal and intramuscular routes is found to be the same, and both are effective to prevent rabies.
How accessible is this vaccine? So, where can the patient come to get these vaccines?
So, the vaccination is available in all government primary health centers and secondary health centers like taluk hospitals, district hospitals, and in all medical colleges which are attached to their hospitals.
Okay. And one common doubt that patients have, immediately when there is an animal bite, they would have gone to a nearby home and got 1 dose of intramuscular vaccine. And since the vaccines are coming with a price, they might want to continue the vaccine in a government hospital. Is it possible that because in the government hospitals intradermal route is given, is it possible to mix the schedules?
So adding to your earlier question, it is essential to complete all the required doses according to the schedule, according to the route that is given. Change of route and vaccines are both possible and effective. And if the first doses of vaccine are given intramuscularly and later doses are given intradermally, it is found to be effective. It is always better to complete the schedule however possible and feasible to the patient.
So the route of administration doesn't matter. Mixing of vaccines or the schedules doesn't matter. The most important thing is that they should complete the whole schedule of vaccination.
Yes.
Yes. And for the management of category 3 wounds, you mentioned about immunoglobulin. Why is immunoglobulin necessary?
In category 3 wounds, which are more severe wounds with a lot of bleeding, the vaccine itself takes around 7 to 10 days to work and produce immunity in the person's body. So until then, because the wound is severe and the viral load is higher, to neutralize the virus locally in and around the wound, something called as immunoglobulins are infiltrated around the wound. They are injected around the wound itself so that the viruses are neutralized locally. And these immunoglobulins are produced from either equine origin or human origin. And recently, we also have something called monoclonal antibodies, which can also be used in place of immunoglobulins.
Okay. Where will patients be able to access rabies immunoglobulin?
The vaccines required for category 3 bites and dog bites in general are available in most primary health centers and government hospitals. Immunoglobulins as such are available in tertiary care centers and government hospitals like district hospitals, taluk hospitals, and hospitals which are attached to medical colleges.
Okay. So it is available in government hospitals, even free of cost. And most important thing is that they should go to the hospital and the doctors will instruct them accordingly. Vaccines are freely available, and immunoglobulin, if at all it is not there also, they will direct places where it is available. One of the common doubt among public is that if a person has already been exposed to a dog bite and has taken the whole course of vaccination and got exposed again to a dog bite, what is the protocol that you follow?
So this is a situation which we consider it as a re-exposure. So where if the person has been recently vaccinated within the last 3 months and is bitten once again by another animal which can spread rabies, then the WHO guidelines say that there is no need for any vaccination or immunoglobulin. Only wound care and local management is more than enough. So if the person is bitten once again after 3 months of completing the previous vaccination, then he or she will require 2 booster doses on days 0 and 3.
Okay. So if at all there is a re-exposure, within 3 months, there is no need of any revaccination. And more than 3 months, 2 doses of vaccine is needed and need to be taken. Okay. Is there any group of people who are at a high risk of getting animal bite in whom you are following any pre-exposure prophylaxis?
Yes,
what is the protocol?
Yes, ma'am. Certain people are at high risk for getting bitten by animals, especially dogs. So they are eligible to get something called as pre-exposure prophylaxis, where you take the vaccines before you are possibly bitten by an animal. Pre-exposure prophylaxis involves 3 doses of vaccination. The vaccines which are given are the same as what the person receives after being bitten by an animal. It involves 3 doses on days 0, 7 and 28.
So you explained about the pre-exposure vaccination for the high-risk group. That is 3 doses of vaccines to be taken. What about them getting exposed again? Is there any change in protocol, or is the same vaccination protocol that we follow for them?
So the pre-exposure prophylaxis, which involves 3 doses of vaccination, is very effective in providing immunity to the person, and the immunity is usually present for the person's entire lifetime. But if the person is bitten once again, it doesn't mean that they don't require any vaccination. They certainly need 2 doses of booster vaccinations, which is given on the days 0 and 3.
So basically it is again the re-exposure vaccination.
Yes, ma'am.
What about the requirement for immunoglobulin?
So if the person is previously vaccinated with the complete schedule of pre-exposure vaccination, which involves 3 doses, then in further bites, they do not require any immunoglobulins.
Okay. So you had mentioned that category 3 wounds require infiltration by immunoglobulins. What about suturing of the wound? Because there had been complaints from the community that I had been bitten by a dog, the wound was big, but they did nothing. When they asked about suturing, they didn't provide suturing only. What is the correct protocol when the wound is extensive? Is suturing mandatory?
The requirement for suturing depends on the severity of the wound. In general, suturing of wounds which are caused by biting of animals is not recommended. So suturing is not supposed to be done unless it is life-threatening to the patient. And even if suturing is very essential, it is to be ensured that immunoglobulin infiltration around the wound is done first and then suturing is done.
So, leave the suturing decision to the doctors. That will be the right advice to give.
Yes.
And delayed suturing is what we suggest.
Yes.
Right? This is an era of pet parenting, right? So, what about vaccinated dogs, healthy dogs, observable dogs? If there is a dog bite, is vaccination required?
So, regardless of the vaccination status of the animal, the treatment for humans is always the same.
As discussed, same protocol. Washing wounds, rabies vaccination, as well as immunoglobulin,
Yes.
irrespective of the vaccination status of the animal.
Yes.
Right? Now, let us burst some myths that are there in the community. One of the common belief that I have heard is that people apply chili powder, turmeric, and cow dung, considering that it's an antiseptic on the animal bite wound.
No, this is certainly a myth and is not at all effective in preventing any rabies. It is not at all advised to apply any chili or turmeric or cow dung or mud in certain cases. And none of these things are actually found to have any antiseptic properties. And they don't actually prevent the infection of rabies.
Rather, they should be going for a wound wash,
Yes.
which is the first aid for the management of animal bite. Okay. Another myth is that only wounds that bleed can cause rabies. What is your take on that?
This is another very common myth where people assume that only very severe wounds or deeper wounds with bleeding will cause rabies. It is not essential that for the wound to be deep or large or multiple for the infection of rabies to happen. Even minor scratch wounds and simply exposure of mucosa of the body, like in the eye or in the mouth or in certain cases where there are open wounds, simple exposure to the saliva also can spread rabies. Even scratch marks can definitely cause rabies.
Okay. I think with that, we covered most of the topics that or doubts regarding rabies that are there in the community. Now, one last question. A person who had a suspected rabid animal bite, when they approach a hospital, what they should expect?
So once the patient visits a hospital after an animal bite, they can expect the doctors to take a detailed history of the event, which is usually followed by the wound wash procedure. And even if the wound wash is done at home, the wound wash is recommended to be done once again in the facility. This is followed by administration of rabies immunoglobulins depending on the category of the wound, which in case if the wound is category 3, then rabies immunoglobulins are administered. This is followed by administration of rabies vaccines and provision of the schedule according to the route of vaccination, which may involve either 4 or 5 visits to the hospital. And they may also prescribe certain antibiotics and antiseptic creams to manage the wound locally. This is followed by an advice to adhere to the schedule of vaccination very strictly. So apart from wound care, anti-rabies vaccines and immunoglobulins, tetanus shots are also given to the patient to prevent infection of tetanus.
So in our country, this stray dog menace is a real problem. Is there any precautionary measure that can be taken so that at least the severe injuries can be prevented?
So it is generally advised to avoid putting yourself in situations where you are bitten by an animal or a dog. But if you find yourself in a situation where you are inevitably going to be bitten by a dog, then the recommended procedure is something called as putting yourself in a fetal position, where you assume the position of a fetus inside a womb, like this, where most of your vital parts and highly innervated areas are not bitten by the animal.
Thank you, Dr. Chiranthan, for your valuable insights. In a disease like rabies, generating awareness is life-saving, and you have contributed to the cause. Thanks a lot.
Thank you, ma'am. Thank you for the opportunity to be a part of BGSMCH Aarogya Vani.
So, dear listeners, rabies is preventable but not curable, and your awareness regarding this disease can be life-saving. So, remember the golden rules: wound care, rabies vaccination, and requirement for immunoglobulin. Do consult a doctor if at all you have a suspected rabid animal bite. If you found this episode informative, please do like, share and subscribe to our BGS Medical College and Hospital YouTube channel. If you have any doubts, please do mention in the comments below. With this, we conclude this episode of BGS MCH Aarogya Vani. Jai Shri Gurudev.